Hello, my name is Eric, and I am the Quality Teams Coordinator here at Good Samaritan Hospital. I'm going to apologize. I won't be looking at the camera. I cannot look at the camera and see my notes at the same time, unfortunately, unless I found a way to put the camera in the middle of the screen. So, moving on. I'm speaking with you today to emphasize the importance of teamwork, and especially in quality improvement. I hope that by the end of this presentation you will agree with me that teamwork is a tool to make your job easier and more fulfilling, while also having many benefits towards performing the mission at Good Samaritan, which is healing with compassion. Teamwork is the structure we use to improve processes. The goal is not only to make processes more effective, but also to reduce elements that cause frustration and interfere with your duties. Some other benefits of quality improvement are that it helps the hospital to meet regulatory requirements, improves patient statistics, and helps to save money by eliminating waste. While those elements result from effective quality control, the means by which this is achieved is by improving systems and processes. For example, let's say you are a nurse on 4 North, and every time you receive an order to transfer a patient out of your unit, there's a slight feeling of dread, because you anticipate that the process will be time-consuming and frustrating, and you will likely interact with coworkers who are kind of grumpy because they are also frustrated. Quality improvement is a chance to determine what elements of the patient transfer process cause frustration and how it could be changed to make it easier for everyone. In the old days, the improvement process was left to an administrator. They might address the issue by asking a couple of nurses about what they think the problem is. Then they would create a new policy that everyone would have to follow. Since the administrator isn't familiar with all the elements and systems of a patient transfer, their solution is just as likely to make the process worse as it is to make it better. Today, we would create a team that includes leadership, but more importantly, frontline workers who are familiar with the process being improved. We include you in the improvement team so that you can point out the elements of the system that frustrate and slow you down. And on that team, you would work with others to brainstorm improvement ideas. Once your team has designed a new policy, we would implement it and monitor the results. If it works out well, great. We're done with that process for now. If the process still needs work, we continue to make adjustments until we're satisfied. In other words, it's not one and done, but an ongoing improvement cycle. Next, I want to talk about the elements of an effective improvement team, which results in high quality outcomes. What we're really discussing is CQI, which means continuous quality improvement. As I mentioned before, quality improvement is a cycle or iterative. It repeats over and over to refine processes. That repetition is why CQI is continuous. Let's talk about the roles of CQI team members. From our earlier example of transferring a patient, we can think about some of the people who would be included in the improvement team, which are mainly those who interact with the process during their work. There would be nurses, a supervisor or two, station clerks, and maybe medical records personnel. Administrators would also have a limited role on teams. It's their job to oversee organizational objectives, and they can provide the authority to get things done, set goals, give guidance, and coordination. The role is limited because they are not the main players in the process. They may be familiar with some of the negative outcomes resulting from bad processes or systems, but frontline workers are the ones who know what's ineffective, flawed, or inefficient. Within a CQI team, there are specific roles. We talked about your role, which relies on your expertise, education, and experience. Also, there's always a leader who will have authority to implement the team's ideas and to solicit participation from various departments who interact with the process being improved. The leader is also a coordinator and will help keep the group focused on their goals and can moderate any passionate differences of opinion. Finally, there is usually a data or statistical specialist who will aid the group in analyzing and deciphering relevant information. CQI teams are effective because they use scientific principles. One thing we do here is have a yearly in-service for all employees on the PDCA cycle, which stands for Plan, Do, Check, and Act. Planning is identifying the factors that contribute to a quality problem and deciding what to do about it. Do refers to implementing a solution, perhaps through a new policy. Check is checking the results of the change to see what's better or worse. Act means either ending the process if we are satisfied with the results or starting the PDCA cycle over if there are more improvements to be made. Now we're going to discuss the importance of cross-functionality for CQI teams. Cross-functionality can be thought of as people at different levels of the organization and from different departments and different disciplines working together on improvement initiatives. Going back to our example on 4 North, we mentioned that nurses, clerical people, and supervisors are involved in the system we are trying to improve and thus should participate in the improvement team. When we look deeper, there are others who have a stake in the process, such as physicians, outcome specialists, and administrators. For instance, if a doctor wants a patient to transfer to a higher acuity unit because their condition is deteriorating, long delays can lead to the doctor's inability to intervene. That lack of intervention can lead to poor outcomes for patients, which hurts the statistics, reimbursement, and reputation of the hospital. Therefore, all of these people have a stake in improving the transferring process and should have a role in the improvement team. Additionally, diverse team members will have talents and knowledge that can synergize, making the sum of their abilities much higher than the total. Also, each representative understands specific elements of a system that relate to their part in the chain, and the improvement process would have blind spots without their participation. Next, we will discuss how team members can be assured that everyone will feel comfortable participating and that conflicts don't interfere with effective communication. In a group that includes administrators, physicians, clinical and support staff, there can be a tendency for some to assert their authority and others to feel intimidated, leading to some not effectively participating. CQI teams need to be a level playing field, where the normal authority levels of the clinical environment are de-emphasized. It is the duty of the leader to moderate conflict, keep highly assertive members in check, while providing encouragement to others to speak up. We ask that everyone becomes good listeners and respectful of others and listens to their ideas. This is what we call a safe environment, where everyone feels free to share without fear of intimidation, criticism, or belittling. If you do not feel comfortable sharing your ideas, you should speak to your team leader in private so they can be aware of any issues and take corrective action. The goal of the CQI team is to unify to accomplish their goals, and if specific voices are over or underrepresented, the solutions the team comes up with will not be balanced and effective. Lastly, I want to discuss some of the resources that will help CQI teams reach their goals. Starting at the top, you have the support of administration and leadership who highly value you and respect the CQI process for increasing organizational excellence. What that means is Good Samaritan has an organizational culture built around continuous improvement. We do not merely react or put out fires. Rather, we are proactive, patient-centered, focused on improving safety, timeliness, and outcomes. Your team will always have a champion who can work with leadership when more time or other resources are needed to meet your objectives. Data is a crucial part of the CQI process. From understanding what researchers have determined is the best practices to statistical analysis of our processes, data should fuel every phase of the PDCA cycle. Most teams will include a member who is a data specialist to aid the team in having the most accurate picture of the real-world elements of the process you are addressing and proven methods for making changes. Additionally, some members will be expected to do their own relevant research to contribute to the process. The EHR software enables you to do searches of scholarly articles as well as browse professional association websites for recommendations concerning best practices, Additionally, every terminal has access to our reference and education material on the PDCA cycle. Other resources. If your team is lacking input from a relevant stakeholder in the organization, your leader will have the authority to seek their participation. There might be a need for material resources. For example, if your CQI process finds that a particular disposable item or piece of equipment may be an element of the problem, your team leader can aid you in obtaining alternatives to test. In closing, I want to mention how personally rewarding teamwork and CQI are. I am sure all of you got into healthcare because you wanted to help people. Teamwork and CQI reward you by helping you to fulfill your personal mission in a more effective way. You can also take pride that you work with an organization that cares about patients and strives to enable you to deliver the best possible care. Teamwork and CQI will benefit you in your career with valuable knowledge and experience that you will take with you wherever you go. Most people aspire to be promoted. One of the most effective ways to demonstrate your value is to develop your skills in CQI and help the organization to be more effective. Thank you for your time. I hope this talk was beneficial for you and inspires you to make a difference at Good Samaritan and throughout your career through teamwork and participation in continuous quality improvement.